published. And this is the first book, which is on primary healthcare in Tanzania through a health system lens, a history of the struggle for primary healthcare, universal coverage. And this small book is on how it's going to be implemented. So Tanzania is rich in primary healthcare history. And these primary healthcare books, which are going to be launched today, have been authored by Tanzania, based on the African context. We believe upon its launching, they will have significant contribution to advancing primary healthcare agenda, not only in the African continent, but beyond the African continent. So the published books documented the evolution of primary healthcare in Tanzania since 1800, and it offers comprehensive history of primary healthcare services throughout many political and cultural transition. But this book, which is brown in color, actually documents the chronicle of pioneering struggle. And in this context, the struggle means the movement and the investment. And it does provide narratives of the context and events that have driven the change in health sector since 1800 and beyond. Looking into the methodology, so we had about 48 contributors to this book, and it has 11 chapters. With the first chapter, it does provide information about the concept and evolution of primary healthcare in Tanzania. It explains how Tanzanian primary healthcare impacted primary healthcare policy, the global policy. And it's all started with the Arusha Declaration in 1967. And you heard from panelists, some of the panelists, and some scholars and historians, they do believe that primary healthcare started in Tanzania. It was declared in Almata, 1978, and it was renewed in Astana. All the facts can be in this. If you want to have those facts, you have to read this book. It's quite very interesting. With second chapter, well, it's about the leadership and governance. And the authors, they were forced to publish another book, so that trying to operationalize the brown book. The third chapter is on human resource for health. Mayor speaks about the challenges we have had in the healthcare system, especially in the evolution, but also the innovations we have been able to put in so that to address those challenges. Chapter 4 is on primary healthcare financing, and I'm glad a couple of panelists were able to speak about the issue to do with the domestic healthcare financing. Chapter 5 is on the supply chain management for health commodities, innovations we have had, particularly in the past 25 years, while Chapter 6 is on health management information and evidence in the primary health care. It does stresses a lot on the evidence as a key driver to scientific implementation of primary health care approach. Chapter 7, healthcare service delivery. The quality issue emerged in this chapter. Whereas chapter 8, that was the talk of this evening. We spent some time talking about it, and I'm glad that the panelists did justice to that chapter. So please, can we give them the round of applause? It was a fantastic one. And chapter 9 is achieving health system resilience. We expect to be having some other pandemics in the future, so we have to make our healthcare system resilient. Whereas chapter 10 is beyond health system building blocks. We have been guided by health system building blocks for years, but the authors challenged the 6 building blocks. they also speaks about the other determinants, the political determinants, the socio-economic determinants, commercial determinants, and the global initiatives being key drivers of primary healthcare agenda. But you'll have those information in detail through this book. And then the last chapter is looking into the future. Here, it touches about the forecasting and the changes and transformation needed for possible solutions. The issue of prioritizing investment thinking or project thinking, but the role of artificial intelligence and machine learning for service provision. So in conclusion, primary healthcare concepts are evolving in pursuit to achieving universal coverage. Therefore, we need to adapt. Secondly, achieving universal coverage is not a moment, rather it's a movement. Third, the past lies ahead of us. Most of the stories we heard from our colleagues here, they are speaking of 1967, 78, 2018. So we need to embrace the past. And then this book calls for urgent need to reorient healthcare system for primary healthcare approach so as to accelerate progress towards universal coverage. I wish to acknowledge the government of Tanzania, our honorable ministers, Foundation Botna, Swiss Development Corporation, Swiss TPH, of course Marcel Tanner has been key, and all contributors.